What are some ways we can incorporate an awareness of antimicrobial resistance into our patient interactions as medical students?
Hi, my name is Olivia. I am an infectious diseases pharmacist at Atrium Health Lake Forest Baptist. And the question I've been asked to answer today is how med students can incorporate talking about antimicrobial resistance to patients. So I think the most appropriate time to talk about this is when you're talking about therapies and medication management treatments for patients. A common example of this would be a patient who maybe comes in with a viral illness and is asking about an antibiotic for treatment. This would be a perfect opportunity as a med student to kind of inform the patient on the indication for antibiotics to treat bacterial, not viral infections, and also talk to them about why taking an antibiotic in this situation may be inappropriate and can lead to antimicrobial resistance down the road.
Hi, my name is Courtney Jackson. I'm the Infectious Diseases Pharmacy resident here at Wake Forest Baptist. I would say in terms of talking to patients about antimicrobial resistance, broader is not always better. And once we know what bacteria is causing a patient's infection, we really want to target it with the most narrow antibiotics to make sure we're preventing resistance going forward.
Hi, I'm Katie Passaretti. I'm the Chief Infection Prevention Officer for Advocate Health. As far as what medical students can do to raise awareness about development of antimicrobial resistance, oftentimes medical students have more time with an individual patient than many other types of care providers. So, that's a prime opportunity to do some education. A couple of specific points. Antibiotics aren't useful for all types of infections, specifically respiratory viruses. We often see antibiotics overused and people feel like they need antibiotics to get better, and that's just not the answer. Also, that antibiotics can have downsides. We need to use them, and they are a great tool when used appropriately, but they do have side effects. They do have the risk of developing resistance, losing those tools that we have, so we must use them wisely. And then finally, as an infection prevention person, there are two ways that antibiotic-resistant organisms are spread. Part is through development of resistance through exposure to antibiotics, and part is through healthcare workers, others spreading infection from one person to another. So always taking the opportunity to reinforce the importance of good hand hygiene, things like respiratory etiquette would be the other plug I would make.